Hi, my name is Jacob Jaremko. As a pediatric musculoskeletal radiologist, I believe that every baby born should have their hips checked for dysplasia. At this stage, hips are still soft cartilage, and detecting dysplasia allows us to treat it simply with a soft harness, curing 9 in 10 infants. This method is possible on any modern ultrasound probe and captures the entire shape of the hip, making this easier to learn than the old method. Before you start, you'll need to make sure you have a room that fits your needs. It will need to have space for a bed with enough room for a parent to stand on one side, sanitizer to clean the probe, a sink, warm ultrasound gel. Scan the right hip with the baby beside you, and turn the baby 90 degrees to scan the left hip. That way, you don't have to reach as far across baby, and baby's head is near mom to be comforted. Turn on the machine and enter your patient's information. This is a good time to ask about risk factors for hip dysplasia, such as family history, ethnicity, and whether the baby was born breech. Undo part of the diaper, but not enough that you could get peed on. Keep the baby flat against the table with your palm to keep them still and keep the position consistent. Make sure the correct side of the probe is up by tapping with your finger. Put on warm gel. Put the probe on the baby's thigh at the crease. I often start scanning a little higher than this at the mid-thigh. You should see an arc shadow, which is the femur bone. Keep the probe parallel to the table. Move the probe toward the floor until the hip joint pops into view. You want a perfect image with these features. Once you see the hip joint well, gently tilt your probe through a range to acquire a sweep video of the whole hip. The best picture from this sweep can be picked up by you or a computer later. Once you've completed this, perform a second sweep of the whole hip. Then, switch sides and do 2 sweeps of the other hip. Once the videos are captured, you can decide for yourself if the hips are normal, or you can check the results with a computer AI package. With these instructions, you will now be able to take high-quality images and help improve the lives of infants everywhere.
I guess for me, being able to see her be checked so quickly was really helpful. And then getting that diagnosis in the moment is also reassuring.
I really like using this way. I think it's a really effective screening tool. It helps just mitigate all the external factors.